Hello, Steve Main back here with Dr. Nario. Dr. Nario is with Biointegrative Health Center in Reno, Nevada. You can check him out online. So today we're going to talk about something interesting, acne. I have a feeling there's a lot of myths out there about what causes it, how to get rid of it, all that stuff. So, Doctor, welcome.
Thanks, Steve, for the invite. And you are right. There are so many things that's involved here. So later on, you'll find out more.
Okay, so what is acne?
All right. So acne, Steve, is those were the days when you were a teen. You're looking at the mirror for hours and trying to see what's going on your face, trying to prick it. And this is when you see it, this is a one punch to the gut that lowers down your confidence in meeting people, especially for the women. But the thing here is acne vulgaris, as we call it scientifically, is a common skin disease, and it affects the majority of adolescents and young adults, almost 70 to 80%. And it's actually hormonal for them. Small percent would be coming from pregnancy and also hormonal changes in their cycles. And at the same time, yes, I mentioned to you, bodybuilders or athletes, for the reason that they use supplements that supports what we call androgens. And you would hear about steroids and testosterone. So athletes are also going to be part of this conversation. But the thing here is it's a multifactorial disease of the oil glands, which is majority will be located on the face and on the back. And complications are the ones that you need to keep an eye on, the scarring on the superficial skin. But the more important ones that we don't see are the psychological scars, the social dysfunction, the depression, anxiety, the suicidal ideations, and the lower down confidence of people who actually has acne. And the thing here is there are three levels of severity. Mild, meaning there are few pimples, whiteheads, and blackheads present sporadically on localized areas. In moderate acne, they are more consistent. And now you're going to be seeing redness, like inflammation in the blackheads and whiteheads, which also now involves a bigger surface area. And now may actually involve the whole face or even the whole back or the chest. Severe acne is the one that actually is constant and often now has cysts and pus that actually is very inflammatory. And there's a large percent of this that shows on the face. Most likely, again, this is the one that leads to scarring, and you want to do aggressive therapy and seeing your dermatologist or your doctor for it.
Okay, so you mentioned hormones, but um, what, is there a main cause of acne? What causes it?
Well, acne is actually there are so many reasons for it, and no, it's not always the bad soap that you're using, and there's also it's not because somebody has a crush on you. That's why you have acne, and that's what always my grandma said until hold on, I have more acne today. I don't think people are liking me because of this. So it's just now we go to the scientific reasons. It's more of the hormones, basically testosterone, especially when it converts to dihydrotestosterone, and it plays a crucial role. And especially for adolescents, you have a lot of these. And enlargement of the oil glands is what it produces, and also producing more oil. On top of this, there's also proliferation of skin. So now you're actually blocking the glands because of skin plugging it up. Thus, when the plugging happens, now the inflammation occurs in the bottom. Thus, you see whiteheads. So whiteheads are the ones that has pus in it, and blackheads are the ones that are glands that are just blocked and does not have any accumulation of pus yet. At the same time, on the area of the skin, there's a bacteria called P. acnes or Propionibacterium. So let's keep it as P. acnes. I don't want to confuse everybody. And it goes in the burrow and now adds to the infection. So as you can see, there's so many things that actually attributes to the pathophysiology of acne. And number one thing that everybody forgets is the microbiome, meaning it actually has a big role if you have a dysfunctional gut, this also will affect the aggravation of skin manifestations, not only acne, but any skin problem.
So you mentioned testosterone. Does that, because females get acne too, right? Is that something different than testosterone, or is that hormonal, or?
Well, again, as we always connotate testosterone, we thought it's always about the men when it's all about testosterone, but women are also prone to have acne because they can also do too much or produce too much testosterone, especially during their cycles, or women who are, of course, heavier because they have PCOS, as we call it, or even predisposed to diabetes and sugar. They produce a lot of testosterone and would aggravate the situation of acne. So it's not an exclusive disease for men.
Okay, so yeah, because it seems 50-50 to me. So as a doctor, in your personal experience dealing with patients, men and women, what can you tell us about that from what you've seen, any patterns, or just from your personal experience being a doctor, what would you say about it?
Well, it's really debilitating, Steve, especially for the younger teens. And you can actually see this with their confidence just plummeting down. And to be honest with you, I myself had suffered through severe acne vulgaris. I share the same story as everyone's. And I also went to my dermatologist and when I was a teen, and all these things that he told me was almost everyone goes through this. Just wait and wait very patiently. It will go away until your hormones get stabilized. And then I was waiting, and hold on, it's not going away. I'm actually now in my early adulthood, and it's still there. And now I go back to my dermatologist and I ask, what's going on? Oh, it's genetics. You just have to live with it, and you now have to use medications. All right, so let it be. Then I was diagnosed with severe acne. I felt like Quasimodo, that hunchback of Notre Dame. I it was disfiguring, and it's like the worst damages I told you are the internal scars. And I had social withdrawal, anxiety, especially with the people around me. I didn't want to go out. It altered my life in a big way. Then a medication called Accutane was prescribed to me by my dermatologist as a last resort. And that gave me hope initially. Use it for 3 rounds, meaning almost like 3 to 4 months. And the thing here, it made the acne go away, but it actually made my liver enzymes go up. It made my cholesterols go out of whack, prompting my dermatologist to say, stop it. So the thing here is the drug got stopped, and again, everything reappeared with a vengeance. So that's the bad part about this. Again, from Brad Pitt to Quasimodo. That's my point. So I tried facial peelings, steroid injections, facial products, chronic antibiotics, all of which drained me financially and physically. But out of desperation, there's only one thing that actually was left for me to try, and that was the alternative path that proved to be most helpful.
So let's talk about medication, because I'm not a doctor, but I've heard and know people that have talked about some of this conventional medication. This stuff is crap. Again, I'm not a doctor, but give me your opinion on it.
Well, as I told you, my experience with conventional treatments, and I am a conventional doc as well. The thing here is there are topical therapies. See, you can use creams. So these are the retinoids. This kind of lessens the plugging of the skin. But the side effects is you actually can get sunburn easily when you use the retinoids. Antibiotics, cream, it can kill the P. acnes that I mentioned to you. And what we call benzoyl peroxide. You can buy that over the counter. It controls the oil production. It also kills the bacteria, but it can stain your clothing and also the bed sheets that you're laying on. Another one for the severe types would be the severe, systemic therapy, such as antibiotics. An antibiotic, of course, you're worried about antibiotic resistance. It destroys your gut. It can lead also to inflammatory damage of the gut. And for the women, unfortunately, oral contraceptives are being used to control hormone fluctuations. And the thing there's so many side effects of oral contraception. And this is said to be controlling the production of testosterone, but it produces headaches, depression, even the risk of female cancers. And lastly, the final weapon, The biggest weapon is Accutane, and this is the one that I used. And again, for women who are childbearing, this can actually be dangerous because it can cause abnormalities in the fetus if you take it at the same time. And it also produces depression, suicide, depletes your
Wow.
B12 and folate, and as I mentioned, high cholesterols and high liver enzymes. So there's always a catch.
Okay, so, you know, your clinic there, Biointegrative, um, tell me about, is there some natural or alternative therapies for acne? Is there other options other than taking some of these medications? So again, I'm not a doctor, but I've heard they can do some serious damage. It can last a lifetime. So what about alternative, more natural therapies? Can you tell us something about those? Do they exist?
Yes, Steve, and to be honest with you, that's the only one that worked for me. And again, my dermatologist mentioned to me that diet does not affect acne. And I was so desperate. I have no more money to pay for all these expensive procedures. The most practical and cheapest way to do this is transition to a plant-based diet. It's difficult because I was an animal, a product eater all my life, and I had to do what I need to do. And in a week that I was doing that, I noticed the pimple count actually lessened and the oiliness actually went down. And this motivated me to do more. And as I continued, I have found the actual cure that I was searching for. But in studies, to be specific, milk protein, specifically whey protein, is the one that causes to stimulate the pimples to grow. And sugar, as you mentioned a while ago, are also culprits, especially the high glycemic foods, the desserts, the cookies that we eat, stimulates what we call insulin and IGF-1 that actually promotes the growth of pimples. And according to Harvard, hormones in milk increases oil production in the face, specifically butter, skim milk. They have the highest content. And the diet and the genetic manipulation rendered to our food, especially the cows now, stimulates the enzymes that actually is not good for acne. And unfortunately, some sad news for the chocolate lovers. Chocolate, especially the milk-based ones, the M&Ms, Snickers, stimulates inflammatory processes that would aggravate pimples. The thing here is, unfortunately, healthy cacao can actually do this also. But again, be in moderation with cacao, though it still has antioxidant properties. And one thing that I didn't realize was sunflower seeds. It aggravates acne by adding 3 extra pimples on studies compared to the non-sunflower seed subjects who took it. Who's counting pimples, right? But this study actually showed that. And another one is a plant that you can use is Berberis vulgaris. It lowers acne by 43% when you use it for 4 weeks. And of course, antibiotics, as I mentioned a while ago, if you take it orally, take it with spore probiotics. That also works in conjunction with the probiotics to lower down the pimple count. And in our practice, we use compounded creams. And of course, yes, we do use tretinoin, salicylic acid, benzoyl peroxide, clindamycin, all the conventional ones combined with natural ingredients, such as biotin, which is good for skin, niacin is anti-inflammatory, curcumin is anti-inflammatory, and also depends on the severity on how we choose a compounded drug for our patients. And one thing that we offer in the clinic is light therapy also that dries up our pimples faster.
Okay. Well, thank you, doctor. That's Dr. Nario, Biointegrative Health Center. If any of you out there listening to this have children or teens or anyone who's maybe suffering with acne, you can look them up and see what their remedies are. Biointegrative Health Center. Thank you, Dr. Nario.
Thank you, Steve. As always, as we all know, the knowledge is power, and thank you for letting me provide you with the edge in longevity and health maintenance, which I call the biological edge or bio edge.